Well, I mean, we try to keep compliance entertaining around here, all right?
We have
So,
to.
there can be this can be a topic that, causes conversation, which is what we always want out of these. If it's not a conversation, then we're not doing things right.
Wow, I can agree with you.
So where would you like to start, Dr. Delgado? Because there's a lot of different ways that we could start.
Okay.
Because when we look at compliance, right? I always like to look at things on the urgent critical matrix, right? What is urgent? What is critical and urgent? That's the way I kind of try to operate. You know this. Ray's pretty familiar with this. Um, Depending on my setting, I could be facing, different kinds of recertifications as well, JACO, ACA,
Mm.
all kinds of fun stuff. So, how would you like to prioritize this?
Okay. Let me first put a disclaimer out there. And this is of my time that have been acting as an auditor for the federal government. Reality is no one, and I'll say you and I have done some audits together, no
Yes.
one is 100% in compliance with the federal government, period. So the fact that, and this is actually why a lot of people don't pay attention to it, because they say, nobody's doing that. It takes too much time to do that. I'm not going to do that. So that's why Medicare basically say, well, the effective date is this date, the enforcement date is this. And a lot of the time people don't realize what does it mean. What it means
Mhm.
is the effective date is when the law takes place. Enforcement date normally is 3 to 6 months later, that now they can get you for that and they can fine you, they can prosecute, they can do everything. And that is done that way to create, I would say, a buffer to the government saying, I gave you enough time. I told you ahead of time. I gave you time to discuss. Then we make it effective. And I still gave you 3, 4, 6 months for you to review and implement before anything happened. But most people don't look at that. As a matter of fact, one of the things that I look at is that most businesses are so busy with so many requirements that I want to look at it. What is the number one thing that if I'm going to do an audit is a got you? And then from then is I got you on everything else. And it's like the door opener. There have been a couple cases where they had, this is silly, they asked the CEOs, they asked senior management, are you in compliance with HIPAA? And of course, I have a compliance team, I have a security officer. Yes, I am in compliance with HIPAA. And they
Of all
come
the
in,
amendments, my favorite is the fifth.
yeah, they come in with some obscure part of
Well,
HIPAA
well,
and they nail you.
hold,
But let
hold
me
on
finish.
though.
Let
Hold
me finish because
Well,
this
hold
is
on.
kind of funny.
I want to see if there's an actual way to answer that question properly, right?
Okay.
Because if I say yes, you nail me with any obscure piece
Yes.
of
Anything.
HIPAA that no one is doing, that no one is doing, right? But if I say no, you're you're self-incriminating.
Yes. I'll tell you the answer.
The answer is what? Refer to my attorney?
No.
It
To the
depends.
best of my knowledge, I have been informed that the task has been completed. Notice that number one is to the best of my knowledge. Number two, I have been informed. And I didn't say, oh, the task has been completed. Because, like I say, anything else, a definite yes means you're done.
Yeah.
They're going to nail you. Uh,
Yeah.
but to the best of my knowledge, creates a ledger of gray that it could be, I don't really remember. I'm so old. I got so many
Yeah,
things
that's
to
the
do.
Hillary Clinton questioning. Yeah.
Yeah. And then
So,
when I
so
say the tasks have been completed, but they got you. They got you that a lot of state and federal governments are using is the security risk analysis. Because number one is one thing that can be used by multiple agencies. Number two is the one that the DAs have been trained on. Number three, you need to do it for and have it available for the last 6 years. So you tell me,
Well, and with all the cyber attacks and everything, that's the first thing they ask for because of where the breaches are coming from.
and then the problem is that once the calendar year finish, if you do it, okay, so it's for next year. So you didn't do it for this year. So you're screwed. So from the standpoint of me looking at the calendar and us chasing some of our clients saying, give me the information so we can do it before December 31st. Because after that, all of a sudden, guess what? The magic find takes place. It's like I was reviewing some of the articles and blogs that I wrote in the past, and you can get away with practicing without a license. The fines are less. You can fix that. But the fact that you have not done an SRA is a $50,000 fine.
Yeah.
Once you clock in.
It's astonishing how many entities out there still don't believe that the SRA applies to them.
Hey,
It's
and that is the key thing. People
yeah.
say that doesn't apply to me, and I actually created some new protocols for other agencies. And I look at it and I say, based on what? If you touch PHI in any way or fashion, applies to you. If you don't touch it, but you are in charge of software or the equipment, it applies to you. It's almost like if you have anything related to healthcare, you might as well do it. Even software companies have to do it, and they don't think about it. So my point is, yeah, there is, and I don't know why. And the other problem is, well, my office manager did it. The office manager did it, or my IT company did it. Mhm. That means they don't understand what it is.
Yeah.
Because I don't know any office manager. I don't know any IT. As a matter of fact, in 30
Let's be
years,
honest. When
yeah,
when the doctor says that, every single time we've been in the room with them, the office manager leans back in their chair and says, "No, no, no, please save me."
yeah. Yeah, because it's not done, but it's the first piece of it's a documentation you must have. And I will tell you right now, tell me what clients, and it would be a nice fun to see, okay, who has it? Let's talk about, okay, so we're 2024. I'm going to ask a client, show me your SRA for 2020. And sometimes the office manager that is there
Boy,
wasn't there.
you're going back. I mean, come on. Let's be honest. Some people don't even know where their taxes are from last year, much less something like this from 4 years ago, right? So, let's just I
True.
mean, if we go how should the SRA be conducted
Every year. And you
every year,
need to keep a
Jennifer.
copy for 6 years.
When you look at this though, yeah, no problem, Jennifer. That's what we're here for, to have to answer these questions because a lot of people don't know this stuff. Um, when we go to the fact that most people aren't doing it, it's still something that the federal government is giving you points for macro and MIPS.
Yes.
So
So
that tells you nobody's doing it.
that's another project I was working on yesterday. And this year, if you participate in macro MIPS, you have to attest, like every year, for the SRA and the safer guards. Most of the people are testing yes, yes. Well, what they
Yeah.
don't realize is, in addition to you already broke HIPAA, so you already have $50,000. Now you're committing fraud because you don't have
Thank
it.
you, President Obama. Now this is
And
criminal.
And that is the first thing I will ask as an auditor. I go into the office, show me your SRA, and I pick a year from the last six. Oh, you don't have it. Oh, but you attested yes. So that means that any penny that I pay you under the federal government, meaning Medicare, I can basically say, you owe me all of that money because you committed fraud. And now
Now
I'm going to
let's
also charge you interest. I mean, that's why the penalties go so crazy.
Yeah, so let me ask you a question, right, about risk management because um employees move around a lot, right? So the person handling macro and MIPS could be the billing person, it could be the office manager. And a lot of times you and I have seen it where the office manager and the billing person leave within 6 months of each other, and it's completely new
Right.
people 2 years down the road, three times over, right? So, and Ray can even attest to this because he's constantly retraining certain clients'
Right.
employees.
all the time.
uh,
Yeah.
so what is the exposure for me if I'm an office manager that just came in? I've been here 6 to 8 months, trying to figure out what kind of mess I'm looking at here. Like, what kind of exposure do I have? Because you and I have both seen where some of these cases go to the office manager, not just the owners of the practice.
Okay. So normally, and this actually you can see it based on multiple things, but normally it goes under senior management. If this is a brand new office manager and she was not the person that did the attestation, okay? So
Mhm.
normally it goes, no, you didn't attest, so you didn't commit fraud. It was the person who pushed the button doing the attestation committed fraud. The owner committed fraud. The billing manager committed fraud. Now, if billing reports to you, okay, so now you committed fraud because you should have corrected that. So it's all any person that have responsibility in that office. It's like when you look at it, and one easy way to do it, and this is why Medicare and Medicaid as the fingerprints. Who are the people involved? Because before it was only the doctor.
Yeah.
But now they say, nah, 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 nah. If you have control of the checkbook, if you have control to make decisions, if you are part of the management team, you are responsible. And that's why they want for certain things the fingerprints, they want the background check because they want to know who you are. They will follow you. And then the problem is that once you are persecuted on their dad, yeah, the doctor, it will always be on her license or his license. But everybody else, you are in trouble because depending on how they prosecute that, you may not be able to work in healthcare for the rest of your life, even
Well,
outside of
yeah,
the
because you're
United
on the
States.
blacklist then.
Yes, yes. I mean, it's serious. Uh,
Yeah.
but and there's so much because there's so many people not doing it. As federal government, it's easy to pick and choose. Who do I want to go first? Although at times I've seen them go after a one doctor with one employee office. It's
Hmm.
crazy. They
I
just
just no, it's funny you say that. I got off not a customer yet, but soon to be. But it's a small massage therapy clinic, and
yeah.
they're taking in referred patients, and they wanted to know, well, their initial thought was all I need is policies, but no, that's that's one part of it.
No.
Um, these smaller practices think that like I said, they think that they don't need
They can
something all
hide.
inclusive or, just because I'm this size, I only need to have this, that's not the case,
No,
as we
about
know.
8, 10 years ago, the Office of the Inspector General actually came out with the guidelines saying, listen, having policies is not enough. And Jose and I have been in offices that, number one, had the policies with the name of a different business or have the policies all closed into a cellophane plastic that had never been opened. So,
Ray, how old are you?
32.
Uh, Dr. Delgado and I have seen policies that are about as old as you are.
yeah,
Like
actually,
you still had, they were on
That's
paper that
crazy.
you had, that was perforated on the side, that you had to fold out and then just take off the ends. Oh yeah.
no, the worst thing has been for me.
It's better that you found him over the inspector, though, just saying.
Oh, yeah. Oh, true. No, but the kicker is a new client that I go in to do the audit. And when I look at the policies, with
It's
policies that I
Powers, that's
created
right.
for another one, and I say, wow, you ripped me off twice. But anyway, uh, so my number one thing is, and that's why I always start with the SRAs. This is a cost of doing business. You don't have the policy, you don't have the SRA. The SRA is the number one point they're going to you. You don't have it for the last 6 years, you're in trouble. Don't mix
Mhm.
anymore because then it will show that you have an intent to basically not follow the guidelines. That's where the 50,000 clicks in right away. Okay. And then if you don't have it for the last 6 years, that's 300,000. And that's where they start. So it makes it easier. The safer guards is a new one. Safer guard is a pain to do it, but a small clinics there is a way that you can do it easy this year. I'm not going to explain it or here because they will get confused. But if you haven't done your safer guards, we can help you as long as you are a small
Safer
clinic.
guide, not safer guard.
Safer guards, I'm sorry, safer guards.
Safer guide.
No, it's safer guards.
Okay.
Yeah, we can check it out.
The synonym to safer guides.
Pull it, Google it. Okay, but the point is, if you are a clinic,
Yeah.
it's true. There's so much work that needs to be done that chances are you won't be able to do it before the end of the year. And the same goes back to MACRA. You had to attest that you completed it. If you haven't done it, now the minute you attest yes, you committed fraud. So that's another one. So we can go to the third one just because Jose doesn't have that much time.
We don't need to finish the SRA. We just need to start it. You need to get it
That's true.
started.
That's true. And we had the
So,
bandwidth to do it, to get them going so that we can finish it next year, but we can start today if needed to be. Although I'm quite busy and you also, but we can take care of them.
oh, my week is pear-shaped, but we'll figure it out for the clients, especially if they call us through having viewed us here.
Yeah. The one thing I don't want to do is on Christmas Day being working on an SRA, which we have done in the past.
We have done that in the past.
Yeah.
Our
Okay.
wives will kill us.
What's your upcharge on a Christmas Day SRA?
It's not
If you
gonna
have to
happen
ask, you
anymore.
can't afford it.
Yeah.
Yeah. It's not gonna happen. I tell you,
I'm a little bit more hungry than that. If you have to ask, you can't afford it. But
yeah. No, for me is I'm gonna have my 3 grandkids with me. Screw it. You don't have enough money.
Yeah.
Okay. So now the BOI, this is controversial. I don't like it. There is an injunction that was passed in Texas, but we don't know whether the injunction is going to stick or not. And this is basically every owner of every organization, corporation, have to register. And the information that they ask is personal information. I don't like it at all. And that's why a lot of people are saying, why is the government asking for so much information? Well, I'll tell you why. It's
turn
because
on the news.
what?
Turn on the news.
Oh, yeah. Yeah, but I say it's because there's so many corporations that are phantom corporations, that the owners are people we don't want to have ownership in anything in the United States, but they have, like sometimes the government do, went a little bit too far with information. Okay. For this year, every time I talk with a client, I say, let me take care of this thing. And if they say, no, I don't want to do it, listen, it's one of those that, again, cost of doing business. In reality, the government owns you. They know everything. They know how much money you have in your pocket. They know what you watch. They know everything about you. So this is just a way to formalize it, to put it on a database. It's a requirement of doing business. Do it before the end of the year because this soccer have some established fines to it. And if not, it would be easier for them to start looking at who are the active businesses in the United States that have not submitted. So you become a target all of a sudden because now they have to check on that. And the fact that there's an injunction that they cannot do anything to enforce it right now, you don't know which way it's going to go. So it's not worth it.
Yeah.
So, matter of fact, Legally Mind send a letter, actually an email, telling people that Legally Mind, which is one of the, I would say, the corporations we work with that actually help. And let me do a little push for Legally Mind because both Dr. Headley and myself are Legally Mind customers. What Legally Mind does to us from the standpoint of legal, from the standpoint of asset management, protection, and then keeping us up to date, no one else does that. So that's why we work so closely together. But Legally Mind send basically the information about the BOI, and they have been doing it for all the clients. Now, Legally Mind say, if you don't want to do it because of this injunction, we can wait. But it's your decision because so far everybody have to do it, even if there's an injunction. So
Quick question before I jet. This is the
yeah.
one-time Department of Treasury piece, or is this something separate? I was talking to an accountant about yesterday or late last week in regards to an annual reporting of ownership.
No, this is a one time.
The one time, yep, the one time Department of Treasury.
Right.
Is it
Right.
the,
Yeah, okay.
I was looking it up on Google. Is it the FinCEN.gov
Yes.
Yep,
website? Okay.
yep.
I'll post that in the chat for the audience.
Yeah. I actually have and wrote a couple of blogs on the Taino Consultants about this thing and what they needed to do. But again, it's something that office managers normally don't get involved. Management or organization don't get involved because it only affects the owners of the organization. And most of the time, like our accountant has been on top of me. Do you do that? I said, listen, as soon as I renew the corporation, I did it. Get it out of the way. I didn't want to have to worry about that. And every time I create a corporation for a client, I do the corporate book, I do it at the same time. It's one of those that do and forget. One of those misses. Okay? Okay. So the I-9, I don't think that I remember I used to be very, very much into filling out I-9 for everybody, but there was a change this year about the I-9. The problem with the I-9 and the beautiful thing about the I-9, again, is one of you must have one for every employee. It's one of those that you complete, put it away. You don't have to do anything else for the rest of your life or their life, but you must have it available because if they come in to do an audit, it's almost like a menu. Okay, do you want an apple pie with that today? Well, checking the I-9s will be one. Although to say the truth is, I never seen anybody doing an audit and asking for the I-9s. But that doesn't mean that it's something so simple. I do it as part of the onboarding. Okay,
Yeah.
might as well complete it, and then we make copies of the other support documents and put it away. Not something that you have to kill yourself at the end of the year, but it's something that you need to keep on mind because some of the laws changed this year. So make sure that you close the year by doing everything you need to do.
Yay, tech stuff.
Oh yeah, I love it. Right, no.
Well,
Okay.
this one interested me. The you said there was some changes in a 1099 law.
Yes, there are.
The
And
1099 law is extremely annoying, but we
I
can
just find
talk
it
about that some more.
intriguing because the whole business associate stuff and
Yeah, and a lot of
1099s and
providers prefer the 1099 rule until certain situations occur. But this is the perfect time. I got a jet, guys, but I'll see you guys next
oh,
week. Ray, don't forget to tell everybody what we're going to be talking about next week, and have fun with this 1099, guys.
thank you for leaving me hanging. I'll catch you later. I'm gonna tell your
thanks,
mother.
Jose. I'll do my best to fill the gap.
Yeah,
Yeah.
perfect. Color commentary. Let's go.
Take care, Jose.
Okay. So most people, when they talk about subcontractors, they talk 1099. And even into bigger corporations, they say, well, we'll have a corporation for every different department just to basically protect themselves from the liability. It's like the bigger corporation is the umbrella, although everybody else is a separate corporation. Even from the standpoint that there are times that I will basically do, when I do a corporation, I say, okay, every provider is a different corporation. So I'm not hiring the provider and assuming the liability for that provider. I'm hiring the corporation of that provider. So that at that point in time, the provider will have that umbrella over the umbrella of the group.
Sure.
So it's very common to have that subcontractors working for somebody. The problem is IRS basically says if the person meets certain requirements, it is not a 1099, it's an employee. And now, as an employee, you have to pay the taxes, you have to do certain things. But I have organizations that they have somebody that they basically say, it's a 1099, so I don't have to pay Social Security taxes on them. So the employee also take additional deductions because they say, I'm a subcontractor. But the employer gives them benefits. The employer basically tell them the hours that they have to work and the places they have to work. So at that point in time is, well, then you are not a 1099. You are an employee. So the 1099 rule is busted. So there will be,
Wow.
yeah, it is like, for example, now let's say in my case, and when I work with other people, I say, listen, okay, so you work for, let's say, EPICompliance, okay? Even if I control your hours and all of that, but you also work for another company. Well, are you a 1099 or are you an employee? Because now you work at two different places. It's the same legal entity working at two places. Well, in this place, I still screw because I still, let's say, for example, I still hire Ray Walters. So he's my employee, but he's also an employee in this other place. Now, if Ray Walters were to say, I'm Walters Services, Inc. or
Mhm.
LLC, and I hire Walters Services, LLC, well, I'm not basically hiring you as an individual. And because you actually provide services to multiple clients, that makes you more of a separate entity. But it's still, have to go back to, are you working the hours? I tell you, are you using the uniform? You're doing that. So right
Sure.
now, there's a couple of cases looking from the compliance standpoint. Because this is what happened all the time. Okay, so I'm a covered entity. I need to follow HIPAA. I need to follow HIPAA security. I need to do my SRA. I have my policies. I train my employees all the time. I have one person that is my IT. And he comes in, checks my computer, does the checks. He have a server that is a backup, even though it's in the cloud. Perfect. He directly never touches my information, but he actually had the server and is the owner where the information is stored.
Yep.
Well, now he fits the business associate. So this person is a subcontractor and a business associate. So a 1099 is applicable, but that means also that he is not in compliance with HIPAA unless he actually have all the policies, does the SRA, he does the training. So what is it that the law say? In this case, the law say, okay, if he is a subcontractor, and as an IT, it could be, then if he does not provide you with assurances that these things are done, you have to basically terminate the contract and get somebody else.
And
Now,
those assurances are essentially approving that the business associate, the IT company in your example was, proving that they are compliant. They have training in place, they have policies. Those are the assurances that we're looking for.
yeah, but now, if he is somebody that only works for me and he wants to be called a 1099, but he only works for me, I tell him what to do, when to do it, how to do it. Well, now he's not a 1099, he's an
Or
employee.
an employee.
So now he's not a business associate. So now he doesn't have to comply with HIPAA, but I need to comply with all of the rules because he's my employee. So there have been some cases with bigger corporations where they were audited because there was a breach, and the government came in and they say they don't have anything to prove that they're in compliance. So the parent corporation said, but they are part of my corporation. And the government say, but that's not what you show on your documentation. So it's either a 1099
1099.
subcontractor
Yeah.
or it's a department of your corporation. So fix that first, and then we will tell you what we're going to do in terms of the breach and how it applies to this piece of the corporation. So it's very interesting. Again, if I were going to go back to the beginning, The two things that we have to look at is the SRA and the BOI and the safeguards. Those three are the things that have to be done before the end of the year. Everything else are things that the law changed. Are you up to speed with this? Do you even know? I know that another organization, and the name will not be said, that have hundreds of people working for them. Some of them they categorize as employees, even though they are 1099s. So I will not be concerned that I have to run and do it, but I will
Sure.
actually, this time of the year is the time to clean up, to start fresh next year. So I would say, okay, let's look at these things. Let's look and see what's happening, who's in charge, how do we go, and be familiar with the law. So this is something I will recommend. But let's go to, yeah. And this is what I'm looking at 2025. In reality, we started working on 2025 in October from the standpoint of EPI. And basically what I mean is we have been updating our policies nonstop all this time. So as we are working on that, we're actually simplifying some of the taskings so that they don't have to do so much. We're actually collecting additional information so that our customers don't have to do that much. And we're going to start everything again. Beginning of the year, make sure that you're doing all of these things. It's starting. Make sure you review your policies, you train your employees, and cybercrime, everything that I'm looking at is getting worse. It's almost to the point of it's not if, it's when.
This year has
What
been a staple year in that category. Just
Oh, yeah. I was doing
between
an SRA for one of our clients, and they identified that this particular device was being hit an approximate of 352 times in October alone.
uh,
352 attacks in 1 month. Come on.
that is
Eh,
crazy.
and the key here is, okay, so what are we going to do in terms of ransomware? Because ransomware is now becoming a profitable corporation, though they are targeting healthcare using ransomware. So one of the things that I do for my own self is I have a hard drive for every one of my laptops in my home office. Because fine, burn the soccer if you want to. I have my hard drive, and all
Yeah.
I have to do is go anywhere, buy $200, $300 laptop, connect the
And
hard drive, boom, and in service. So ransomware doesn't matter to me. Everything is encrypted. You're not going to get anything out of this computer. It's basically a block of hard rock, if you want to say it. So
so is that what IT companies should be pushing moving forward, is having individual backups for, these large companies, these
okay, now
hospital-like systems, I mean, just looking at Ascension Health, they went through a ransomware attack and changed healthcare and, you know,
yeah, the problem is, I know several companies that say, no, no, but I have a backup.
hmm,
And I ask, okay, great. Have you checked your backup? What do you mean? No. Is the backup working? Is the backup device even working? And sometimes I found out that it's being corrupted. So there's really nothing. Actually happened to me once that I was checking my backup. I said, what happened here? There are files missing here, here, here. So I had to reformat the backup so that the files were there. But the key here is look at it this way. You have so many patients, and those patients, all of a sudden, your system is hijacked, ransomware. You don't have access. What are you going to do
right.
about medications? Because you don't have access to that. And this is life or death. How are you going to refill them? You don't know whether they're taking in what doses or anything like that. So it doesn't matter. Now, one of the, I would say, in OSHA, in HIPAA. And there's a couple other licensing requirements that talk about the emergency management plan. And again, most people are not doing it. But the idea of the emergency management plan is the what if. Will your office be able to continue operation if something happens? Now, it's kind of funny because I've developed quite a few of those for licensing purposes, especially Medicare. And
Sure.
Medicare even was asking, well, if you cannot bill, what are you going to do billing if you don't have the system? I said, I couldn't care less about billing because now, as I'm doing whatever backup I'm using to continue to provide services, I can put it in a piece of paper and I will bill it later on. Billing for me is not a priority. Patient care is. And like I say, there was a blog that I'm playing with that I'm going to be writing about what happens when ransomware strikes. What happened with those patient files? What happened? Okay, this patient needs clearance because they're going to go and have surgery. And it's a surgery that is not emergency, but you got to do it very quickly. Otherwise, they're going to die.
Sure.
What do I do? So I basically have to bring in the patient, do a full examination, check everything, and then I go back to medication. Well, maybe I need to call somebody else that is in that patient to send me a copy of their medication so I can see what it is. You see, it's so much work I have to do because I wasn't prepared. I said, no, I gotta do this. But the problem is, and look at it at the last bullet, I gotta look at this thing from the standpoint of Medicare. Medicare is gonna pay us less money next year. All of the insurance companies have all kind of games going on, trying to limit services. Well, if I'm gonna get, so matter of fact, the OIG did a study where they found that claims that were sent clean to the different insurances were not paid. And the way they are using AIs to deny
Yep.
claims.
All right.
It's all out there. So the key thing here is if I'm going to play the game, I need to learn the rules. If Medicare is going to pay me less, well, where do I make the money? Do I bring an AI and fire my staff? Heck no. I mean, because AIs are not there. Eventually, I say, not that I'm going to do it, but it's going to happen. AIs are going to take over and do most of the jobs. So where do I find either an increase in revenue or I'm going to have to cut benefits or cut costs some way, somehow? This is happening. And there are people that are not looking at it. And there are people that didn't make money this year. So if you didn't make money with what was happening this year, how are you going to be making money next year? And then what happens? And this is the funny part that, okay, so I'm going out of business. Well, I'm closing my clinic. Guess what? Even if you die, you're still responsible for patient records. So people don't think about that. Even if you close, you're still responsible for so many of the regulations that, okay, and how do I get away with it? That
It's up
requires
to that.
something.
It's up to what, 10 years or
10 years
six?
after you are dead,
Yeah.
you're still responsible, or your family is responsible for the medical records of your patient. Uh, Under HIPAA, 6 years, you
Yep.
need to be responsible for all the documentation, no matter what. So it's kind of, other than our clients that have been with us that period of time, I don't know that anybody can provide the required documents that are supposed to be kept for 6 years under HIPAA. They don't. They say, "Oh, those are medical records." HIPAA doesn't deal with medical records. It's not about medical records. It's SRAs,
Yeah.
it's policies and procedures, investigations, and there's a series of documents that you must keep for 6 years. And those are the ones that, when they come to audit, they never come to audit. Like, for example, if they were coming today, they could say, "Hey, let me see your document for 2018. What documents? Here are the medical. I want to see your policies and procedures for HIPAA. I want to see any meetings, any training, and your SRA. Your SRA being the first thing."
Hey, good luck.
Yeah, if you don't have it, you're in problem. Now with Medicare, like I say, in my case, actually my case, Jose's case, in terms of Medicare price reductions and all the insurances, we took a hard stand, and basically in our clinic, we only accept cash and Medicare because with the cash, we are able to do other things. So you cannot play this game. So, Jose, you're back.
I'm back.
Welcome back.
Boomerang.
Yeah, well, I was just talking to one of our clients and actually about the SRA. So, yeah, I'm a little concerned for our client, but that's none it's
We were talking
they're
about
part of an MSO, for
retroactive
lack of a
audits.
better term. And
Okay.
the MSO is saying, "Yes, I'm the security officer at the MSO level, but the individual practice is on their own. But the MSO level is the one that creates the policies and procedures. But the practice responsible for making sure that everybody has access to them and knows what's going on. But it's it's a client it's a giant cluster duck. It's a giant cluster duck.
You know that the funny part, I was talking about that. An organization that owns a sub-organization and how the liabilities pass back and forth. But
It's
this is ugly.
wild to me. Like I wanted to message our client separately, and I may just do that anyways and inform him that, hey man, you're the scapegoat.
Yeah.
You're
You're on the hook.
100% the scapegoat. And when they give me access to these policies and procedures that, by the way, no one in the individual practice actually had when I did the walkthrough, nor did they know where they were, nor did they know they
So it was
existed.
only the compliance officer that had access to
Yeah,
them.
the
Man,
compliance officer at the MSO level.
So basically, it goes back to the fact that they have policies and procedures. The law is very, very, I would say, clear about this thing. Every employee in the organization must have access to policies and procedures.
mhm.
Done. There's nothing more. So him having policies and procedures in his office that nobody knows or nobody have access is actually saying, I am guilty.
Well,
Please.
so the problem is that I spoke to some of the department heads because they've recognized me and we've done work with this practice in the past. They didn't know where these things were either.
Yeah.
And this is a practice with 100 plus employees, 9 locations, working with multiple hospitals. This
Okay.
is
Don't say anything more, but the bottom line is for the purposes of an audit, it doesn't exist. They are not in compliance,
no,
period.
and that's the problem.
Yeah. And that's the
And the
problem.
reason why I'm bringing it up here is one, we're talking about the SRAs, but two, we're talking about saving our admin people that are drowning in everything else.
Yeah. Yeah. But that's why I created EPI, because the problem was that when we went and worked with different offices, we created all these documents. The office manager put it in her office. Nobody had access. You're not in compliance, period. There's no way I can protect you. But when they are in EPI, every person in the organization have access to the policies. Perfect. Plus, we have areas that are only for management. So we can control, we can allow the whole company access, but we also can control certain documents to only management. So, but you don't see that in most organizations. And it's a shame about that. But
And I'm trying to think about what options managers and administrators have when they're presented with these situations, right? Like, and I and I don't know if there is any.
you want to know the truth or you want to go to Disney World?
Well, the only, I mean, the I don't, you don't have a choice. There's always a choice. You can always quit, right? Like, but I mean, if for whatever reason you want to stay, there's I mean, short of documenting everything and trying to push liability back, but I mean, now you're just playing a game of risk management.
Reality is that most of the people that work in a management position in healthcare, there is a strong level of loyalty there
Hmm.
where they wouldn't turn on their, let's say, supervisors.
Yeah.
The problem is that with that also goes, okay, so you are loyal, good for you, but you have to do these things. And if you don't do it, then it's like you see somebody stealing and you just hold the door open for them. Are you an accomplice? And in this case, yeah, if you are in a management position that you can make decisions, you are an accomplice of this thing. If you are the one, which it happens most of the time, doing the attestation, guess what? No, you're guilty. So it gets to the point of where do you draw the line based on yourself? How much push? If you really want to help, it's say, listen, we need to do this, we need to do this, we need to do this. We have
Yeah.
some office managers that have been champions, and I'm glad for that because they went to the doctor and said, listen, you want to buy that new scope, but before you buy that new scope, you gotta do this. For me,
Hmm.
when I speak with a new client, listen, I can talk to you all you want, but if you don't meet compliance requirements, I'm not gonna waste my time. Period. Because it's just like you telling me you're not gonna follow the law, you're not gonna get the licenses. Why should I even get involved? Because then now it's my reputation. So I don't play those games. You don't follow compliance, don't. But okay, the important thing here for the people is I go back to repeat the three things. SRA, BOI, tell the owner, make sure that he does that. And if you are on Medicare, safer guards. Those are my three things. And then the next thing will be prepare for next year. I'm very concerned about the money. I was talking with Jose about the clinic, okay? How are we positioning ourselves? Where we are? What do we need to do? What clients are we going to see? What is the networking we need to do? I mean, one of the things in most businesses that people don't think about it is marketing. And marketing, you can lose as much money as you can throw in.
Uh-huh.
And that's why it's important. Well, what kind of marketing am I doing? Well, the first thing is what kind of client do you want? And then where is that client? And then that's where you start looking at marketing because there's a lot of people spending money. Well, there's still offices that don't have a website.
Yeah, that is funny. Which
Yeah.
isn't that now a problem with ADA?
Is it a requirement to have a website as a medical practice? You know what? I never knew if that was the case.
You
'Cause
know what?
I deal with them all the time. There's so many.
It's ADA. It's an ADA issue.
Not only, there's also a HIPAA issue. There's quite a few regulations now that require a website. I
Interesting.
find it funny and I find it scary. But it's
Jose, that might be a good topic in
hard.
the future. Just saying.
Yeah.
Oh, the why do you need a website?
Yeah. Yeah.
And what you should have on the website?
Well, what you should have on the website is more important than why you need a website.
Sure.
It's almost like I don't carry
You
business
s-
cards anymore.
you say that, but we just talked about this. There are people that don't have websites.
I know.
There are people still marketing
Goes hand in
in
hand.
newspapers.
What if you don't have a website, but you have a Facebook business
Doesn't
page?
count.
Doesn't count.
I would almost say that's more liability, not less.
Yeah, because there's things that in the website, there are certain things that are required by law that you need to have on the website. And a Facebook account will not provide you with that. And the other thing is that you need to put certain disclaimers to protect you. You need to provide certain access. So there are certain things, and at certain points, there are certain things you need to put on that website. If you have
Yeah.
a breach, you have to put certain information on the website. So there are requirements in terms of what you put there and how you use it.
So let us
Facebook.
know, guys, if that's something that you would be interested in us going over, because I feel like that's something we could easily do a topic on without diving too deep or too much into the technological weeds on.
Yeah. So, okay. So again, I wanted to keep it simple, short,
Mhm.
we're very close to Christmas. I don't like to do a lot of work during Christmas, but every year I have one client that a couple days before
Without
Christmas,
fail.
they
Without
were
fail.
audited by Medicare. And
Without
then if
fail.
either you get all of these things by the first of the year or you lose your license. I actually
Yeah.
do have one case like that for a physician that I need to do certain things before the end of the year or he will lose his license. But
It's wild that they do that when you know that they're not working with the way the holidays fall on 3 days next week and 3 days the week after that.
yeah, but if you don't do it, they don't
Oh, I
care.
know. I know. Oh, I know.
Yeah.
So yeah, so I
Even-
mean, Ray, did you tell them what we're doing next week?
No, I just put a comment in chat though. So we're not doing our usual Tuesday just because of the holidays next week. So we are switching to next week's webinar to Monday, same time, 1:35 p.m. Eastern Standard. This topic, we're going to be talking about a couple cases that Jose found of some multi-million dollar, some audit cases that resulted in
Fraud
multi-million dollar
cases.
or fraud cases. I'm sorry, that
Yep. Yep.
resulted in
Yep.
multi-million dollar fines, and we're going to sort of dive into those cases, learn how to safeguard your organization for not not having that happen to you. So.
So to give you guys a little bit more of an idea, I'm gonna look at it on the consulting side of it, right? Because the news articles are gonna tell you, hey, they're guilty of fraud, and this is how much they owe the federal government. And I'm gonna sit here and tell you how easily you could do this without even realizing that you were doing it.
Mhm. Yeah.
Like like one of these is a very common issue with kickback, and it has to do with marketing, believe it or not, and
Ah,
the way and who is involved. And this is a $50 million fraud case.
yeah.
So I got two or three of those. I'm gonna have the articles so that way Ray can put them in the chat and you guys can look at them in your leisure next week. We'll dive into them. We'll have a little bit of fun with it, and then we'll be thankful that it's not us that's happening to us right before Christmas. So,
Yeah. And then for New Year's, which I believe falls on a Tuesday, right? New Year's.
yep, New Year's
So
Eve.
we'll be conducting I think that yeah, we'll be conducting our webinar episode on the 30th, which is a Monday, for that
Next
week as
two.
well.
So that's the next
Yeah,
two
next
on
two
Monday, not
Mondays.
Tuesday.
Next 2 weeks, we'll be conducting our webinar on Monday. So just be on the lookout for the registration. And yeah, we'll go from there.
Okay. Well, guys, I'm gonna see all of you. So
Yep.
everybody have a great Christmas and understand that from the standpoint of EPI and Taino, we're doing the work to help you out because we have been there. We're actually there with some of our clinics. So what we do is for you as well. So stay always in tune and any questions, let us know. Okay?
Yep. Have a good one,
Absolutely.
guys.
You too.
Thanks, Dr. Delgado. Thanks, Jose. Merry Christmas and Merry Christmas
Okay.
to
Merry
everyone.
Christmas.
We'll see you next week, next Monday.
Okay.
Yep. Bye.